Hi, I am Professor Pedro Forcada. I am medicine doctor, cardiologist, specialist in hypertension and cardiovascular mechanics. I will talk to you in the next minutes about the prevention of coronavirus 19 infection in cardiovascular patients. Epidemics are linked to humankind like a tragic heritage, and we can track them from the ancient civilizations to nowadays periodically every 100 years, probably related with urbanization, overpopulation, and domestication of animals, as most of them are zoonoses. Other characteristics are great movements of populations due to wars or natural disasters, or simply the improvement of transportation and traveling. In the 14th century, the epidemic was called the Black Death, also known as the plague, and was caused by a bacteria. It killed along 6 years almost a half of the known population of the world, especially Europe, and it was following the War of Crimea. The next great epidemic was in the 20th century after the First World War, and was called the Spanish flu. This was the first produced by a virus and had a catastrophic impact. In 2 years, infected 500 million people and killed between 50 and 100 million. In particular, this was very aggressive with young people, the soldiers, making difference with traditional pandemics attacking elderly, children, and weak, malnourished people. Movements of troop, malnourishment, stress, and chemical attacks may have contributed to the increase in aggressivity and wide dissemination. Since then, influenza keeps killing 500,000 people a year around the world, but is considered controlled as the virus is less virulent nowadays, and there is also vaccination. Moving forward, most of the pandemics in the 20th century were due to virus, mostly related to in the beginning to the H1N1 influenza virus, the Asian flu in 1957, and the Hong Kong flu in 1968, were progressively more severe, and the last one killed almost 1 million people. Following the airborne viruses, two bloodborne epidemics slashed the humanity, AIDS and Ebola. More limited due to the way of transmission, they are contained but not finished until nowadays. As example, AIDS in 2018 was carried by 38 million persons and is responsible of 770,000 deaths a year. In the 60s, the coronaviruses were first described, and particularly the coronavirus beta, known as SARS producers, which is severe adult respiratory syndrome, that appeared with tragic pandemics in 2002 and 2012, and the current one produced by the coronavirus 19 at this moment, with almost 3 million infected, 200,000 deaths, and 800,000 recovered in 185 countries involved. Coronaviruses, as all viruses, is a small particle containing genetic material, in this case ribonucleic acid, which is that encodes the information to replicate the virus once it intrudes the host cell. Covered by a capsid, in the coronavirus it resembles a crown, corona in Spanish, composed of glycoproteins, which allows the virus to survive in adverse conditions and find a host cell to replicate. There are two types. One is the alpha coronavirus, responsible of 1/3 of the bad colds, mostly confused with flu or influenza. And the other are the beta coronavirus, responsible for SARS, with 3 pandemics. In 2002, one with epicenter in Guangdong, the other in 2012 in the Middle East, involving close 30 countries, but absolutely not comparable with the third, the coronavirus 19 we are facing now. That is exponential in terms of infected people and deaths. When I received the commitment to prepare this talk on 20th March and the first try 14 days later, the number of infected grew 4-fold, deaths 6-fold, and recovered people only 2.5 times, reaching 164 countries involved. At the moment I'm recording this, you can see in the Johns Hopkins page the current stage of the pandemic, with almost 3 million infected people, 200,000 deaths, and 800,000 recovered, which shows an impressive stepped exponential curve, as you can see in the bottom right. The curve is with a very, very important slope, and for the spreading of the disease and fatalities. And this later, fortunately, still remained in a case fatality rate, CFR, of 0.07, in spite of the frightening news coming from United States, Italy, or Spain. The bad news are that the curves of infected and dead people are still growing in most of the countries. This data give us two important lessons. Airborne viruses are highly spreadable and contagious, and personal isolation is a key strategy to fight them. Of course, you may wonder what is going to happen since I recorded this presentation and the time you are looking at these features. And let's analyze this project of the transmission of the dynamics of the coronavirus. And it shows the different alternatives of the outbreak with an intervention like isolation for 4 weeks. And it results in a reduction of the spreading rate of the virus between 40 and 60, which are the light blue curves. And we can see that maybe the peak of the dome could be between June and July. How we can face the coronavirus 19? The home pages of the World Health Organization and the Center of Disease Control of the United States released easy and downloadable materials, easy to understand and widespread, that recommend identifying potential contaminated people, personal isolation, avoid spreading microbes with germs, with cough and sneeze using the elbow, use of mask, wash the hands frequently, clean contact surfaces, and ventilate closed spaces, and so on. But personal isolation is one of the main strategies, as the virus is airborne and contaminates surfaces where it can live from hours to days. In this feature, you can see a central street in Buenos Aires a Saturday night before and after the quarantine. At least in Argentina, it seemed to be successful to flatten the infection curve, even when it was installed by the end of March, which is late. The so-called strategy of the hammer and dance, due to the change of the slope of the dome, more important as much are the containment measures, consisting of gradual isolation, and later on, once leaving the quarantine, avoiding the relapses. An excellent example of this seems to be the observations made in Wuhan, the epicenter of this outbreak, where is clearly seen the impact of the isolation measures. Since the detection and the national alert system, which is the first dome, and the second dome, after the declaration of pandemic of the World Health Organization. And during the quarantine, what? Here, there are practical counseling, especially for cardiovascular patients who are particularly high risk, and in general to everyone undergoing personal isolation. For cardiovascular patients, it's especially to avoid contact with young people who can be asymptomatic carriers. Keep the cardiovascular medication according to doctor prescription and take care of stock enough, and keep the programs of exercise and diet for cardiovascular disease adapted at home. And for general patients, and cardiovascular patients could follow these indications, is exercise at home, at least minimum routines, like with a fixed bike, dance, or like gym, as you can see in the graph at the right. Keep healthy sleeping habits in timing and duration because it stimulates the immune system. Drink plenty of liquid, better if they are hot, because the virus is sensible to the temperature and especially hot. Keep a healthy diet, regular, light, and nature. Manage stress, virtual socializing, stay busy, recreational activities, and avoid negative messaging through the networks. Regular breathing exercises, like simple regular breath during 5 minutes, or yoga, or qigong, or similar. Why cardiovascular patients are considered at risk. Cardiovascular patients are particularly sensible to virus infections like influenza, and in the prior outbreaks of coronavirus SARS, the prevalence of cardiovascular patients was significantly higher, and so was the mortality. The initial observation in small samples coming from Wuhan showed that cardiovascular patients were most frequent than diabetics and chronic obstructive pulmonary disease or oncologic patients, and required significantly more intensive care units. A bigger series by the end of February with 72,000 patients showed the extreme aggressiveness of the coronavirus 19. At the right of this slide, you can see the comparison with the 2002 outbreak with 8,000 infected and 800 deaths, and the higher numbers in half of the time that the coronavirus 19 reached almost 3,200,000 deaths. And this series confirmed the higher prevalence of the cardiovascular patients. In the center of the graph, you can see that 1 out of 10 is a cardiovascular patient, and particularly the case fatality rate, and this is a CFR for patients with cardiovascular disease, is 5 times higher than controls, which in the case of diabetes, hypertension, of chronic obstructive pulmonary disease is only 3 times. That's why the World Health Organization considers high risk those elderly than 60, those with cardiovascular disease, with pulmonary conditions, or diabetes. In the case of the Center of Disease Control of the United States, they consider elder than 65, people with asthma, those with AIDS, and a group of high risk for severe illnesses. This group, for definition, is elder than 65, home or institution-based patients, patients with chronic obstructive pulmonary disease or asthma, with a serious heart condition, immunocompromised, severe obesity, diabetes, chronic kidney disease or dialysis, and liver disease. What is the heart vascular connection with the coronavirus 19? All the attention was driven by the pulmonary effects of the coronavirus 19, but immediately it was recognized that the coronavirus 19 infection is accompanied by a tremendous inflammatory response, named properly a cytokine storm that leads patients to die. In the case of cardiovascular patients, it is well known the role of inflammation mediated by cytokines that in several cardiovascular diseases like coronary artery disease, heart failure, stroke, or arrhythmias. The crucial role of vascular dysfunction that in the lung produce the SARS in the arteries lead to endothelial dysfunction and thrombosis. The underlying presence of hypoxia, sympathetic disbalance, inflammation, and vascular dysfunction may precipitate plaque rupture and a myocardial infarction. Coronavirus 19 enters the cells using specific receptors like ACE2, which are spread in several organs, but mainly in the lungs and cardiovascular systems, as you can see at the right of this slide, which explains the aggressivity of the virus against both in the middle of a severe inflammatory reaction and spread microvascular coagulation leading to SARS, respiratory failure, and cardiovascular complications. So, the take-home message is that the cardiovascular patient is at high risk for infection and dying of coronavirus 19, and so special care is recommended in those elder than 60, diabetics, those with cardiac conditions recently intervened or programmed to coronary bypass graft, angioplasty, implantable cardiodensifibrilators, valvular prosthesis, heart failure at any stage, valvular disease, hypertension, especially if it's uncontrolled, and patients with cardiac arrhythmias. Let's go in deep into the vascular aspects of coronavirus infection. It is well known since 2012 MERS outbreak of coronavirus that it used the receptors to penetrate the cells, and one is associated to a link in the change of essential system to control blood pressure in mammals, the renin-angiotensin-aldosterone system. This is the ACE2 enzyme, a protease spread in several organs, but mainly in the lungs. This enzyme is a protease that breaks and inactivates angiotensin II. Angiotensin II is a powerful vasoconstrictor, a pro-remodeling and inflammatory substance. If it is left enough time at high concentration, causes lung injury, myocardial ischemia, inflammation, endothelial dysfunction, and oxidative stress. So ACE2 is a protector, and if the virus latches to it to enter the cells, produce downregulation of this enzyme, and then facilitates the tissue injury, in particular lungs and myocardium. This was the reason of a warning quickly viralized when the pandemic started that the drugs blocking the renin-angiotensin system increased the risk of infection because the virus followed the renin-angiotensin system. Immediately, most of the cardiology societies worldwide released statements and positionings that it was not true, and that the real risk is that if a cardiovascular patient abandons the drugs without doctor's advice or control, they will be at a higher risk of infection. And if the cardiovascular condition gets uncontrolled, so. Currently, this is under assessment, and an important group of investigations think that these drugs, especially blockers of angiotensin II receptors, increase ACE2 levels and can be protective. Paradoxically, a group of investigators that worked on ACE2 for 20 years proposed to use recombinant ACE2 receptors as a decoy to redirect the virus away from the target cells. This smart line of investigation was approved by Food and Drug Administration on 22nd April 2020. Can we assess the vascular effects of the coronavirus 19? We can assess the vascular properties using the vascular package of Resona 7, including vectorial Doppler B-flow, that can give us a closer evaluation of the artery's structure and function using novel tools like radiofrequency, B-flow, wash, stress, as you can see at the right in the middle of this slide. And endothelial function might reveal the state of endothelial cells because they are one of the targets of the virus, and through them causing microvascular damage lead to the progression of the lung disease and later on the development of multiple organ failure. As endothelium covers most of the vessel surface and has a tremendous amplification power, this can explain the deadly cytokine storm described by the coronavirus 19 patients. What are the cardiovascular warnings during the treatments of the coronavirus 19? Coronavirus is extensively studied actually, even using artificial intelligence exploring thousands of possibilities to attack it. The steps that the virus follows are under zoom. How it spreads through the blood, how it reaches the receptors to intrude into the cell, how it accesses the system of protein synthesis, how it attacks and takes command of the cell nucleus, hijacking it, ordering only virus production until cells die at a dreadful speed, and the consequent triggering of inflammatory response. All these ways are under study and several approaches are being essayed currently. One example is azithromycin. How we can interrupt and capture the protein system synthesis half the way of the cell colonization. But we have to take some precautions. Combinations of drugs sometimes bring associated the positive results, but serious adverse effects. Several cardiac interactions, especially arrhythmias, must be considered when combining hydroxychloroquine, azithromycin, and antiviral drugs, especially in fragile and severely compromised subjects, in particular, cardiovascular patients. In this way, several warnings have been released by governments and societies. What are some unexpected lessons from the coronavirus 19 pandemic? The first is that there is a significant reduction by almost 40% of consultations due to acute myocardial infarction and cardiac procedures in the United States. The explanation is related to the fear of cardiovascular patients to the break of isolation. In this sense, cardiovascular societies clarified that in the case of cardiac symptoms, patients should consult anyway. In our country, there was a reduction according to our National Registry of Acute Myocardial Infarction cardiac procedures, about 50%. The second lesson is that cardiologists are high-risk doctors. Even that the entire medical system is facing an historical challenge, cardiologists in particular face that cardiovascular disease is a disease with the highest prevalence worldwide. Cardiovascular patients are mostly high-risk population, and a great proportion of cardiovascular patients must be evaluated during lockdown. Cardiologists must perform more frequent and varied cardiologic procedures, and cardiologists must be involved in prior and during intensive care unit evolution of the patients, and of course, must be involved in the follow-up of the survivors. So let's go now for a round of the most common patient questions released in summary by the American Heart Association and the European Society of Cardiology and the Center of Control Disease of the United States that are collected directly from the patient consultation, doctor's office, or telemedicine consultations. As information to patients is crucial to fight coronavirus 19 outbreak, it is very important to listen to their questions and anticipate the problems. So let's initiate a round of questions, and that we can recover from main cardiologic societies like American Heart Association or the European Society of Cardiology, directly collected from the office, where doctors receive the questions from the patients, maybe some questions coming from some colleagues also. The most important thing is that we have to be very careful of the patient information. We have to teach them about the warning symptoms of the coronavirus infection, the risk factors for the infection of coronavirus, of course, the population at risk, and the conditions that put the patient at risk. The specific dissemination of guidelines about the information and the treatment measures against the coronavirus. The lifestyle management that we are counseling to the patients, we will speak a little ahead, and a treatment interaction with the coronavirus therapeutics, especially some antiviral antibiotics used in the treatment of the coronavirus, and especially for the treatment of inflammation and disseminated coagulation, and the chronic treatment management of the survivors. So let's see some of the questions about the prevention of the coronavirus infection. And the patients used to ask if they have a heart condition, if they have different measures of prevention. This is yes, they have to be more strict in terms of the prevention measures. They will have to try to avoid the vectors, which must be the young people, especially sometimes closer to them. And so, in fact, the isolation measures must be more strict for cardiovascular patients. The patients ask also if they have a heart condition, if they have to self-isolate. And yes, if there's someone who is going to be benefited of isolation is the cardiovascular patient because they high risk of his condition. And the point is that the viral charge that you acquire when you are out of your house and touching the place or surfaces where had been the virus, you charge the virus and you are more exposed to develop symptomatic infection. Most of the patients ask if they have to use mask. Actually, we know that masks must be used by everyone, but especially the cardiovascular patients. But sometimes it difficults the respiratory mechanics, and they question why they have to use, so they can use the mask that are like a shield in the front of the face and protected from the microdrops, which are very important, that don't get in touch with the eyes and the nose and the mouth, and especially a frequent cleaning of the hand washing of the hands. Most of the patients ask if the household pet can transmit the coronavirus. Until now, it has been not demonstrated. Even if the pandemics mostly are originated from zoonosis, they are not transmitted by the pet, but you have to be very careful to clean the paws of your pet after going to the streets, as you do with your shoes. If I had a coronavirus 19 infection, if I became immunized, and yes, the answer is that you will develop immunization. Of course, this new kind of virus is not particularly well known in terms of how soon you are going to develop the immunization, how much it will last. But according to the first sorts of coronavirus beta, they left immunization. Should I keep my medication? This is a very important question because in the very beginning of pandemia, there was very information about that some drugs to control blood pressure called angiotensin-renin system blockers like ACE inhibitors and blockers of receptor 1 were adverse or increased the risk for coronavirus infection. And most of the cardiologic societies made statements and guidelines clarifying that it was not true. And maybe some of these drugs are protective, especially angiotensin receptors blockers seems to increase the ACE2 and counteract the infection of the coronavirus. Should the patient go to the scheduled appointments to the hospital? So not the chronic scheduled appointment, but according to the isolation guidelines in the country where is the patient and the condition of his cardiovascular situation, maybe patients must need to go to regular cardiac evaluation, especially if they are symptomatic or they need titration of medication. Let's see another block of questions, which are most direct to the particularly the cardiovascular patients in the current practice of the cardiologist. And if the patient has a cardiovascular condition, if the patient has more risk in this point, the societies tend to be different. Americans tend to be more strict and less paternalist than being the Europeans. And it is clear that the patients with cardiovascular disease have an increased risk of infection, an increased risk of dying of cardiovascular coronavirus 19 infection. If the symptoms of a cardiovascular patients are different of those who are not a cardiac condition. The cardiovascular patients usually have symptoms. In the case of heart failure, as example, involves dyspnea. And so patients may develop the symptoms of the infection of coronavirus faster because of the fragility, and they are more prone to develop the infection and faster. So they have to be very careful of the initial and light symptoms of infection, which have been made of common knowledge. Can coronavirus 19 cause heart attacks or arrhythmias? It has been demonstrated that certain components of myocardial affection and the disbalance of the sympathetic tone and inflammation may conduct or lead to myocarditis or pericarditis or arrhythmias, but are the most rare or less frequent cardiovascular complication during coronavirus infections. The question completes the first one is if the people with heart conditions are more likely to die of coronavirus 19. I have shown several graphs during the presentation that they are at increased risk. The case fatality rate is almost 5 times higher than control patients or patients without heart condition. Is to be older the same as having a heart condition? So the age is one of the worst risk factors for coronavirus 19 infection. And the point is that cardiovascular disease increases with age. So is this more frequent that you will combine the cardiovascular affection with the age? So these patients has 2 points of risk, and we have not still enough epidemiological data to separate one of the other. But the frequency of cardiovascular disease increase with age, so the risk increase due to the comorbidities with age, not only by the age itself. If I have a heart condition and I think I am infected, should I go to the hospital? And the answer is absolutely yes. If you are sure that you are mild symptoms of possible coronavirus infection, as they have been described in the guidelines or the governments or the charts, you must consult with your doctor or go to the hospital immediately. And now we have here some questions, but are more in the professional arena, coming from the professionals involved in working with the coronavirus 19 infection. And it's adapted from a document from the European Society of Cardiology released 5 years ago. The first question is, who of the cardiovascular patients are at increased risk of coronavirus infection? As this question comes from this document, I prefer to answer following exactly the charts of this document. Those with chronic obstructive pulmonary disease, those with heart failure, any of the stages of heart failure. Here, the heart failure stages 3 and 4 is very advanced, but in the earlier stages of heart failure, they are high risk. Those waiting for any cardiac surgery, not only coronary revascularization, even replacement of heart valves also are at risk. Immunodeficiency or prior organ transplantation because of immunosuppression. Hypertensive patients, I have explained about the hypertension, especially if it is not controlled or without treatment of recent onset hypertension. Coronary artery disease, especially if symptomatic. Cerebrovascular disease, Diabetics and severe overweight with this pathologic obesity are the patients at higher risk in the cardiovascular group of patients. Hypertension is the most common cardiovascular comorbidity. What is advice for the hypertensive patients? If you look at the document, you can see that the chronic follow-up of a hypertensive patient who is stable must be followed in telemedicine or at a distance. Patients must measure blood pressure at home and refer to the doctor and keep regular contacts with the doctor. And there's no need to make any consultation, even or only if blood pressure is out of control or if there is any adverse effect of the medications. The patient must schedule a visit to his doctor. In the case of hospitalization, the conduct with the antihypertensive drugs will be adapted to the cardiovascular condition of the patient, and if he is hemodynamically stable, or if there are concomitant conditions like renal failure or alteration of the ions, especially potassium, because the treatments for coronavirus can cause life-threatening arrhythmias in the presence of hypokalemia. What are the most common cardiovascular complications due to the coronavirus 19? This is a graph coming from the prior presentations, and you can see my current version: heart failure, myocarditis, and arrhythmias. In cardiovascular patients at risk, which biomarkers should be measured and when? Okay, there are 3 biomarkers that have been shown altered during the coronavirus 19 infection. The high sensitivity troponin T. It is useful in ischemic heart disease, myocarditis, and heart failure. Is the earliest marker that goes up during the coronavirus infections. The brain natriuretic peptide, which is very useful in heart failure, but in chronic conditions is a very important marker during the coronavirus 19 infection. And the D-dimer, especially for disseminated intravascular coagulation, pulmonary embolism. But until now, due to the lack of enough strong evidence to support doing these measurements regularly in coronavirus infected patients, it should be decided by the criteria of the treating doctors and the need, as example, of anticoagulation, as example, or initiate cardiovascular active treatment drugs. According to new guidelines, the pulmonary ultrasound is recommended for prevention and screening of complications. Replace or complements the transthoracic echo or transesophageal echo. This is a very important question because there is a lot of discussion what is the image diagnosis of the pulmonary compromise of the coronavirus infected patient, but especially if we are speaking about cardiovascular patient, this is very important to recognize if there is a cardiovascular underlying condition like heart failure causing the severe respiratory distress. And of course, the ultrasound is easy, available, and using radiation, and can help to make the diagnosis of what's happening on the lungs. Of course, we know little, not too much about the pulmonary echo in heart failure. And of course, this is a new condition, it's acute respiratory syndrome, but there are some typical patterns or images in the pulmonary ultrasound that can be used to detect the pulmonary compromise. And it is not necessary that the pulmonary ultrasound must replace the transthoracic echo. the esophageal echo is only used if it's going to change the management of the patient. So the diagnostic procedures must be conducted in a suspected coronavirus patient only if they are going to change the patterns or the management of the patients of the treatment that doctors are conducting with the patient. As you can see here, this number of Lancet propose that echo must be used in the first line to diagnose the pulmonary compromise close to the stethoscope or earlier than using the radio imaging of tomography or resonance to detect the pulmonary lesions in the coronavirus infected patients. What will be your take-home message for cardiovascular patients in terms of well-being, lifestyle, and medical social interaction during the pandemic? I will summary 3 things coming from the document I was telling to you. The first is I moved the video in order that you can see the 3 frames, interaction with others to avoid the people who is sick. Keep the distance, wash the hands frequently, cover the mouth and nose with a mask, avoid touching the eyes, nose, and mouth. To remove the virus from surfaces, clean them with disinfectants frequently, self-isolate in case of any of the symptoms of suggestive of coronavirus infection, stay at home, isolation as much as possible, and maintain physically activity. In the case of healthy lifestyle, maintain a healthy lifestyle, eat healthily, quit smoking or reduce smoking, restrict alcohol intake, get adequate sleep, and keep physically active. Isolation and physical restrictions may lead to inactivity and increased risk of events and combination of comorbidities. So it's very important to correct this if you are in a program of cardiovascular prevention or cardiovascular risk factors. Physical activity should be strongly encouraged, and this is exactly opposite to the isolation. So outdoor areas open and keeping the distance could be useful if it is permitted in the country and should be adapted according to local regulation. And the medical advice is to continue with the prescribed medication for cardiovascular disease, seek medical help immediately if experiencing symptoms suggestive of coronavirus infection, and in a case of symptoms of cardiac disease, consult immediately. Do not neglect the symptoms. Do not interrupt the cardiac follow-up if you have symptoms or your condition gets unstable, so there are adverse effects with the medication or deterioration of the cardiovascular condition. And the final, this is some graphs about the measures of lifestyles that we were talking about. Drink abundant liquid, exercise and walk, especially in the closed areas of your house or garden. Use virtual methods for socializing. Avoid the excessive negative messaging. Stay busy with gardening, cleaning home, ordering or reading. Focus on breathing. That's all. Yoga, qigong, or any exercise, and eat well regularly and healthily. The last question is a much more personal question for impression about what are the COVID-19 pandemic, the great challenge for humanity. What is the impact that I expect for cardiovascular medicine? Well, I will answer the question with, I moved the video to the center, and I did T2, which is the tau sign, and we can see the positive and the negative conclusions about the impacts on cardiovascular medicine. And the positive, I think that the teamwork will be improved. The teleeducation is going to be improved, and the telemedicine also. A strengthening of the prevention concept. I think this is a great addition in terms of prevention. Increase the range of prevention measures reaching to the lifestyle. More resources for medical progress. The development of new social networking and pollution reduction, which is incident on cardiovascular disease. And the negative aspects, I think, on cardiovascular medicine is that the cardiovascular prevention has been halted during the lockdown. The negative impact of this prevention pause will be seen for years. The hidden complication without diagnosis, as I have been telling about the reduction of the consultation, but because of myocardial infarction or for cardiologic procedures, increase of the cardiovascular burden resultant of the prior points, unbalanced distributions of medical resources, because I say that there will be more resources for medical progress. I don't know where they are going to be sent, if not for prevention of cardiovascular disease, but maybe infectious disease. The post-crisis effects, always after a great crisis, it's not within the crisis, it's after the crisis. There is effect of increase of cardiovascular disease. So we have to prepare for the post-pandemic period. And the negative impact of isolation. Cardiovascular disease is very sensitive to personal isolation, social isolation of the patient, and the psychological burden of the pandemic fear if the outbreaks repeat one after other along 2 or 3 years. So I think that there's a balance. Always there's a beginning in the end. And so we have a lot of history to write on. Thank you very much. Keep fighting. Stay at home.